On hospital campuses across the country, triage tents now help manage the crush of people fearing they've got COVID-19. Any needing hospitalization are isolated. Brigham and Women's Hospital in Boston has set aside an entire COVID wing. Doctors and nurses in full protective gear.
We're spending up to 2 hours at a time in these rooms with all of the equipment on, which is very difficult. You can't really breathe that well, and it's very hot, so you get very exhausted wearing it.
Tonight, the American Hospital Association says it needs $100 billion immediately to deal with the emergency, as med centers nationwide tell staff to conserve masks.
In some cases where it's as safe as possible to do so, actually reusing those. And then for other things like respirator hoods and goggles, we are being told to save those so that they can be cleaned and reused later.
The government promises more are coming as the CDC recommends making masks out of scarves and bandanas. Also today, the president said 2 drugs already approved for other purposes are under review for COVID-19 patients: chloroquine, a malaria drug, and remdesivir.
It's going to be very exciting. I think it could be a game changer.
But the drugs are not yet approved for COVID-19 and may not work. Remdesivir, originally designed for EBOLA, may work better on coronavirus. Chris Kane was put on the experimental drug in a Washington state ER and says he saw fast results.
Within 48 hours, I was feeling a lot better. But I mean, I got a 5-day dose of it, and then I got home from the hospital over the weekend. So.
The good news, most people who contract the virus will have mild to moderate symptoms and can treat themselves at home.
It's not much more than getting rest, staying hydrated. If you have a fever, maybe taking, medication for the fever like ACETAMINOPHEN. But the most important thing is really to practice social distancing.
Meanwhile, with young people ignoring pleas to stay inside, the resident physicians at Abbott Northwestern Hospital in Minneapolis have their own message.
We stay at work.
For you. You stay at home for us.
Tonight, the Massachusetts Medical Society says the situation there is dire. Not enough protective equipment for doctors, nurses, and technicians on the front lines of the pandemic.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.